risk of stroke is vastly underreported in the literature. I think it's probably upwards of 10% in the transcatheter aortic valve replacement population. And I think that placing a Sentinel is going to reduce that risk by 2/3 within 72 hours of your procedure. So that's a significant decrease, and that's why I would encourage you to have the device during the procedure.
Well, it's a good question, and I think what we found as we've understood more about stroke during TAVR procedures is that the risk of very slight strokes is perhaps higher than we realised. So I would say that your risk of having a serious stroke, losing the strength down one side of your body, losing your speech, something really awful that we hope above everything we can avoid, is perhaps 2%. We call that a kind of major stroke or disabling stroke. But the risk of having a minor stroke, is higher than that, and we'd have to say it's maybe 5%, possibly even a bit higher than that. And then beyond that, we know that it's very common for little tiny bits of material to go up to the brain. We don't really know what the long-term effects of those tiny bits of material is going to be, but we feel that if we can prevent anything going up to the brain, that's got to be a good thing. Now, if we use the cerebral protection device, the studies that have been done so far have been in a relatively small number of patients, but they do seem to show that the risk of stroke is reduced, perhaps by as much as half. And as I've said to you before, I think this is a procedure that doesn't add any negatives to the TAVR procedure, but that's the positives it might add. Reducing that risk of having a major stroke, but also reducing the risk of having any material going up to your brain, and that would be the ideal situation.